We have to be very careful what we do to Medicare right now.
You know, Congressman, with all due respect, 2.9% of every earned dollar in this country is going into the Medicare system right now. The premiums are at the moment based somewhat on income. That was a recent change. So everybody's not paying the same premium, and Medicare is already going broke. And my question really is, how can we expect to run a single-payer system when we can't even run Medicare in the black with 2.9% of every earned dollar in the United States going into the system?
And what's interesting too is all of a sudden, the congressman doesn't want to talk about means testing. That's one of the things that's been off the table. Why is that? If you're earning enough money in your retirement to pay for health care, shouldn't you be part of the solution? We want the insurance companies and the pharmaceutical companies and the hospitals to bring dollars to the table, but we don't want wealthy Americans we want to allow wealthy Americans to continue to take money out of the system. Congressman, I didn't realize wealthy Americans was such a large part of your constituency.
Well, you know what? This attempt to try to pit people against each other that you seem to want to encourage, I don't think is acceptable. If people happen to be wealthy and they're paying taxes, they should get a benefit for it. Hello? But beyond that, this issue of whether a single-payer system could work. Look, every other industrialized democracy in the world has less spending. We have 16% of our gross domestic product.
And they provide less end-of-life care for health benefits as well.
Wait a minute, people get preventive care. They live longer.
The preventive care for heart disease and high cholesterol in Europe are actually below U.S. levels, so that's completely untrue.
We're going to send everyone to their corners. We're going to send everyone to their corners because poor Diane's been waiting on the phone from Illinois to talk to us. Hey, Diane, how are you?
I'm fine, thank you.
What's your question?
My sister and I are 6 years apart. One of us is obese, and the other one is super skinny. And we both have the same health problems. And so the cost would be identical for both of us. So could this be genetics and not just because one of us is obese?
That's a really good question, and I think it speaks to the issue of, can you treat everybody the same way? You and your sister share a lot of genes, but you have different physiologies. At the end of the day, your doctors have to treat you differently. The bills that are in front of Congress now want to have everybody treated the same way regardless of their own personal health circumstances. So when you and your sister go to the doctor, you don't want the doctor saying, I have to treat you each equally because that's what Uncle Sam, MD, told me to do. You want the doctor to have the ability to treat you each separately based on your own individual needs.
Are you suggesting that her obesity is genetic? Is the caller there?
Right.
Yes. I don't know if it is or not. I know that there are a number of generations that have been obese.
I think that's why it's important to have the doctor really understand who you are personally so they can provide the best quality of care to you, each of you, individually.
Paul, there's been a lot of talk about this whole notion of obesity, maybe making their expenses be a little bit more so they front a little bit more of the burden. Is that part of the solution?
Well, yes. Candidly, there are substantive studies that point to this $147 billion expense as a result of obesity and differences in presenteeism, productivity, absenteeism, related conditions like heart disease, type 2 diabetes, and others. So I don't think that's the issue. The caller's question points also to this. Do we know the best way to treat every individual? And the answer is no. But we also know that the science around the accuracy of diagnosis, the appropriateness of treatments, what's referred to as evidence-based medicine, is not routinely followed. In studies Rand has done, 55% of the adults are treated based on the evidence. Similar set of studies, 47% of the treatments in pediatrics. So we know that in medicine, that the judgment of the physician can be much better, the accuracy and result much better, if the use of clinical technology is a part of that. So we can't just default to it's the doctor's judgment alone.
Right. Congressman, other than you advocating eating healthy and us discussing it, what is the government going to do to reduce the obesity rate and equitably spread around the cost of treatment?
We have to acknowledge that the previous caller raised a question about whether there's tendencies toward obesity genetically. That's a science question. But there's another question here, and that is personal responsibility. We are all responsible ultimately for our health. I mean, that's just a fact. Now, some of us may have tendencies towards illness, but our culture promotes obesity with the ever-presence of fattened diets and sugar and the advertising that's out there that promotes people to eat certain things, that what they used to feed children in schools, what the candy bar machines and the pot machines.
We can talk
this
about
is something that
But we can talk about society all we want, but there was a recent study by some researchers at Stanford that suggests that the type of insurance system that we have in this country, private, employer-based, and public, encourages obesity because you basically don't pay if you get heavy in this country, and you have medical problems and costs related to being obese in this country.
This is a good discussion.
I know.
It's a good discussion, but we got to be careful about just punishing people because they happen to be obese. And, you know, I'm hardly the person to advocate for obese people, but I have to tell you, we have to be careful about punishing them. We have to look at the cultural markers that help and push people to consume. And if we look at that, we may be able to help people. But this is something that, you know, there's individual responsibility metrics here that we cannot ignore.
Okay.
And at the same time, we got to be careful about punishing people.
And he's right, we have to be careful because there are genetic issues involved with this as well. It's not just eating too many cheeseburgers. But we got to go to break right now.
All right, some final thoughts on health care and overhaul. Peter, you wanted to get in here.
Well,
at
the end of the day, if you want to compare apples to apples, people in the United States will tell you our system needs to be reformed, but they're very happy with their own individual care. People in Europe will tell you they're unhappy with their individual care, but they like the system. So in reforming our system, I don't agree that we need not-for-profitism. What we need to do is stop demonizing all the people that play, stop demonizing doctors, stop demonizing pharmaceutical hospitals, and everybody who's involved with the system, and bring everybody together to solve the problem. Uncle Sam does not have a medical degree, does lots of things well. Determining how a doctor should practice medicine is not going to be one of them.
Before you throw out the health care that 250 million people rely on in the United States, it would be really nice if we had a debate where everyone had an opportunity to read the legislation and debate it before it was passed. What is the rush to throw out this system? I don't see it.
Congressman, you want to address that quickly before we go?
Well, some of the numbers you're talking about include people who already have Medicare, which the government helps fund. I just want to say that you have to keep in mind that people cannot afford health care. There's 50 million people. Half the bankruptcies in the United States are connected to people not being able to pay their hospital bills. We clearly have a problem with a for-profit system, and it's time really to help our businesses, help our industries with a system, as one of the previous guests talked about, a systemic approach. And that's what I'm advocating
with John
Conyers, H.R. 676.
Medicare is the government program, and the hospital fund's going to run out of money in about 8 years. That's not a problem?
You know,
and that's
I agree that
we
need to control costs, but the reason why we're having trouble with health care in America is that $1 out of every $3 goes for the activities of the for-profit health insurance industry. That's what the big fight is about.
You know, one of the things we didn't talk about was malpractice, tort reform, things like that. I mean, that's at the root of all this, too. $60 billion.
That would be self-insured in this system I'm talking about, be covered. Doctors would be covered.
Everyone, thank you so much.
The doctors would be covered.
There are going to be many more hours and days and weeks and months in the future to talk about all of this. So, everybody, I just want to thank our illustrious panel from the past hour, Congressman Dennis Kucinich. Congressman, you're welcome back anytime.
Anytime.
I appreciate being with you.
Of the Powell Financial Group, and also Peter Pitts of Global Healthcare at Porter Novelli. Thanks to all of you.